After Florida approved the use of medical marijuana, physician groups around the state responded to meet the need. One of them is here in Jacksonville. Daniel Locke is with Medical Marijuana Physician Group, Compassionate Alternative Care, and he joins us now. Good morning.
Good morning, Melissa. Thanks so much for having me.
Thanks for being here. Of course, this is legal now for a number of conditions: cancer, HIV and AIDS, multiple sclerosis, Parkinson's disease. Your physician group is responding to this. Tell me about the practice.
Well, we saw the need in the industry, and I did a lot of research, and actually a couple of people that I knew were giving me some feedback on how wonderful it had been for them to get off the opioids. And I knew that at some point, you know, people are going to start responding, trying to get off the opioids and take care of the chronic pain.
This is, you think, a way for people to transition off opioids, which is an epidemic in this country.
Yes,
medical marijuana.
Yeah. Oh, absolutely. I hear the stories every day. I'm so blessed to get to hear these patient stories, and they're all very similar sometimes.
How does it work? How do people come to you and get this medication?
Well, first thing they'll do is, you know, they'll pick up the phone, give us a call, and say, hey, I want to get a medical marijuana card. That's sort of how it goes. And then what I tell them is, do you have one of the conditions that the state says qualifies you? Okay, and if the answer is yes, and then my next question is, have you seen a physician for this condition within the last year? Well, if you have, then what I ask you to do is come in, fill out a medical release form. I'm going to submit that to your current physician. Once we verify that you have that condition, then I'll make you an appointment with one of our physicians.
Right. And so what would you say to those who are worried about abuse of the system and abuse of the medication you're prescribing?
I tell them that the real gateway drug to the abuse is opioids.
Right.
Okay, we don't need to go into that, but there has been no cases of somebody overdosing on medical marijuana. There's been no cases of somebody graduating. You know, we were conditioned back in the 80s, you know, it's the gateway drug.
Yeah.
It is absolutely the opposite of the gateway drug.
How do people take it? Do you give it to them in pill form, tincture form?
Good question. Yeah, there are multiple ways in the state of Florida. Different states have different rules. In the state of Florida, the majority of folks are vaping. Okay, just because that's the something that just so you can vape, you can take pills, you can take oils, and actually edibles have been approved, which will be out next month.
And the number of practices like yours are springing up. This is booming across the state now, isn't it?
Yes, ma'am. If you look, there's, you know, just a handful, 8 or 10 of them here in Jacksonville. I think there's one physician maybe in St. Augustine, then the next one's all the way down in Daytona. But in South Florida, where the older population is, that's where it's more predominant. I mean, the average age of a medical marijuana card holder is 58 years old.
They're graybeards.
That's exactly right. You know, the retirement community down in was it outside of Ocala? Oh my goodness, the dispensaries are wrapped around.
All around the villages, huh?
The villages, thank you.
Yeah. Not what you might expect. So people, I think, have so much interest in this.
Yes, ma'am.
And people might not realize that there is a practice right here in Jacksonville. You are just west of downtown, correct?
Correct. We're right off of Beaver Street in the Beaver Street Enterprise Center. So we, you know, thought we would kill 2 birds with 1 stone, help, you know, they have startup businesses there, and they've been fabulous for us.
Now, it's fair to say the legislature was not a big fan of this becoming the law.
Correct.
But since it's become law, have you had any hiccups or red tape, you know, in setting up this business?
No, ma'am. I mean, I wouldn't have done it had I not hooked up with a lady down south who's actually our consultant, and she's consulting about 180 physicians throughout the state. And we're just all following the same drum, same consistency, and that's, you know, you don't feel like a lone ranger out there trying to get it accomplished.
Which patients are seeing, Daniel, the most success with medical marijuana? Out of all these conditions that you prescribe for, you know, Crohn's disease, Parkinson's, epilepsy, cancer, this whole list, which patients see the most success?
Well, anybody with chronic pain. Believe it or not, I mean, the way the law is written, it's one of those conditions or something that is associated with it. You know, for example, fibromyalgia. We're seeing so many women with fibromyalgia that are getting off the Lyrica and all these harsh drugs. And something that most folks don't know, CBD is non-mind altering. So here in the state of Florida, we have THC and we have CBD. Okay, so somebody who's older who says, you know, I never experimented with that stuff in the 60s, we started with CBD and they get the benefits without the head high that comes with, you know, the THC.
You can learn more at Daniel's website. He's with Medical Marijuana Physician Group in Jacksonville. The website, compaltcare.com. Thanks so much for being here.
Thank you so much, Melissa. I really appreciate you.
Later in the hour, street artist Banksy's work is being exhibited in Jacksonville.